Hey, good afternoon, everyone. Just waiting to make sure that all of our spokespeople are on here and we will get started. Obviously, a big day, so let me just make sure that everyone's on here. And like I said, we'll get started. All right, looks like we've got everybody. So thanks for joining. Again, this is our weekly COVID-19 update. We've got Warner Thomas, our president and CEO, Dr. Robert Hart, our Chief Medical Officer, Dr. Sandra Kemmerly, System Medical Director of Hospital Quality, and Dr. Catherine Baumgarten, Medical Director of Infection Control and Prevention. So with that, we'll go over some information, some of our hospitalizations and numbers, and then we will open it up for questions. So with that, I'd like to turn it over to Warner.
See, there we go. I sound so much better on mute, but anyway. Good afternoon. Thanks for joining us today for our weekly briefing. We will kind of go through the numbers and then certainly take whatever questions you have. I guess first of all, we're announced today at Ochsner with Pfizer now receiving full FDA approval. Ochsner is moving forward with mandating a vaccine for our employees. So we did announce that internally today. I think we've issued the press release. I'm not sure if that's gone out or not. So we had a meeting internally with our leadership today. We'll be communicating with all of our employees today. So folks will have until the end of October, I believe October 29th, to be fully vaccinated in order to continue to be scheduled to work at Ochsner. We also, at that point, will also, folks will need to be fully vaccinated in order to become employed by Ochsner as well. So that will be part of the criteria we look forward to. So we are now at about a little over 69% of our folks are vaccinated with at least one dose. We're at 66% fully vaccinated. That number climbs every day. We see employees getting vaccinated every day, and certainly with the mandate, we anticipate that will climb significantly in the coming weeks. So happy to answer questions on that as we get into it. As far as our COVID census, I would say it is a very serious and critical situation in our health system and in hospitals around the state. We have 979 COVID patients across our organization today. That is down from 1,034 about a week ago. So we have seen a decline from our peak, but we are really seeing just more of a flattening and a plateau, not a continued decline in a significant fashion. So that's something we certainly are worried about. We'll just go around the region real briefly. So Baton Rouge, for our facilities, at 71, down from 82 last week. The Bayou is at 102. They're relatively flat. New Orleans is down to 326 from 362 last week. We're flat in Lafayette at 170. North Louisiana is up to 120 from 99 a week ago. North Shore and our partner facilities on the North Shore down to 190 from 214 a week ago. So and that's 979 total across the system, down from 1,034 a week ago. Most of that decrease really being in the greater New Orleans area. If you look at our COVID patients, about 88.5% are unvaccinated. We have 265 COVID patients in our ICU, and 151 are on ventilators at this point in time. So it's a very, very significant issue. And, I think that we did talk last week that the previous week we had to postpone 1,160 surgeries and procedures across Ochsner. I'll tell you today that we've now gone back and looked at this from when we really started delaying surgeries and procedures, which was the last week of July. And from the last week of July to today, we've delayed over 5,000 surgeries and procedures across our system. Over 5,000. So if we don't think this is impacting other people, then we're simply wrong. And we are working very hard every day to be able to identify enough bed capacity so that we can continue to increase the number of surgeries we're doing for people. But this is absolutely a critical situation, and one that we is frankly not sustainable. And so we want to encourage people to keep getting vaccinated. The way out of this is to have folks continue to get vaccinated. And that's one of the reasons that you see that we are now mandating vaccines across our system. We have, in the past week, we've administered over 10,000 COVID tests. Positivity rate is down actually to 13.8%. So that's a positive, and we're seeing good progress there. We now administered over 523,000 vaccine doses. We did vaccinate about 100 people at the Saints game last night. So once again, we will go wherever we can find crowds of folks that we can vaccinate. I mean, our goal is to vaccinate people. We've done this at drive-thrus. We've done this at grocery stores. We've done this at Saints games. We do this at other get-togethers, as well as in all of our clinics and clinical locations. So we're going wherever we can find folks to vaccinate them and to take care of as many folks as possible. So Robert, I'm sure I missed a bunch of stuff, and or Sandy or Kathy, but those are some of the highlights of what's going on around Ochsner. But it's it's a really challenging situation now, and I will say that the staffing issues that we've had continue to be a major issue. I will tell you, we are searching across the country to bring more nurses in, and we simply cannot find them. And I think part of this is because there are surges in lots of the southern states. I was just talking to a healthcare executive in Dallas. They're in a very similar situation. I talked to an executive in Florida. They're in a very difficult situation. So the staffing challenges that we've had continue to be a significant issue. On a positive, our staff that are quarantined because they've tested positive from COVID was at a high 2 or 3 weeks ago at around 530. We're down to 300 and I think it's 360, 366 employees that are out on quarantine now. So, Robert, maybe I'll stop there to see if you got things you want to add to any of those items.
Yeah, I think just to highlight what you said about the number of procedures and surgeries that we've literally had to put off, and or just to be honest, we've kind of quit scheduling for the time being because of the fact that we don't have the staff to continue to care for the load of COVID patients and do all of the normal things. So it definitely is affecting. I was on a call with somebody from Nebraska. They're starting to see the same thing, to Warner's point earlier. Dialing back surgeries and procedures, can't find staff. So this is affecting us all across the country, and which again drives the importance of getting this vaccine that's now been approved, FDA approved. No longer can we sit back and say, I'm waiting on FDA approval. It's approved, it's safe, it's effective. We need to get this so we can continue to pull ourselves out of this pandemic and begin to move back forward with our lives.
Kathy or Sandy, do you guys have any comments before we kick it back to Nicole to see if there's how we want to handle the questions?
I'd just like to add that we're continuing to see increased numbers of cases in our pediatric population. We've had 35 pediatric patients just in the month of August, and currently we have 15 pediatric patients throughout our system in the hospital. And so children under the age of 12 cannot be vaccinated, so it's important that the adults around them get vaccinated to protect the children. So we are concerned about the number of pediatric cases we're seeing with this Delta variant.
Dr. Baumgarten, is there anything you want to add?
Sure. First of all, I'd like to thank all of you that are on the call with us today, because certainly we appreciate your help in getting the word out about vaccination and the safety and need to do so, especially when we know we're losing lives daily due to people that are reluctant to take the vaccine. We know that 88% of those in our hospitals are unvaccinated still. And so we know that that would be 88% of people that could be at home rather in the hospital if they had been vaccinated. There are a few kind of misinformation items online that we would like to talk about and make sure that are cleared up, because we know we need your help to be sure that this misinformation is cleared up. One is about ivermectin and treatment with ivermectin. We know that this is a medication that's used in the animal industry in infectious disease, which Dr. Kimberly and I practice. We only use this for parasites. And we know from the data, it's very clear that ivermectin is not an appropriate treatment for COVID. And so we do want to be sure that people are aware of this and don't take ivermectin, either from a veterinarian source or any other source, to treat or prevent COVID, because it just doesn't work. And then the other piece of information we'd like to talk about is to be sure that people understand about monoclonal antibodies. We do treat people that have gotten COVID with monoclonal antibodies. And in those that have gotten them, that is passive immunity. We don't give the vaccine for 90 days. But for people that have not received monoclonal antibody for treatment of COVID, they can go ahead and get the vaccine after their symptoms have improved from COVID and they're no longer in isolation. So I'll stop with that, and I'll turn it back over to you.
Yeah, thank you, Dr. Baumgarten. And Warner, do you have anything to add? We have started to get some questions, but I just wanted to make sure there was nothing to add before we dive into some questions.
No, I just had the question about, are we worried about staff calling in sick after being vaccinated while we're being short-staffed? I think we're more worried about people calling in sick because they test positive for COVID and have issues with COVID. So no, we want people to get vaccinated because that will help keep them safe. We know if they do have side effects, which is pretty rare, that usually they're just a 24-hour type of situation, and then folks are back at it. And we've had thousands of employees that have had no side effects and have gone right back to work and not had any issues at all. So I'm more concerned of having folks out who test positive for COVID, who are sick or get seriously ill, versus folks that may be out because they get vaccinated. The question about pediatric visitors and parents, we are not requiring visitors at this point to be vaccinated. That is something that we will continue to consider as we continue to look at our visitor policy, but that is not something we're doing right now. So anyway, I just hit those two. Nicole, I'll let you, I don't want to do your job. You're better at your job than I am at your job. So
You want to take it? Yeah.
actually, you're better at my job than I am at my job. But anyway, so.
No, I don't want your job. Okay, so Emily Woodruff with the Times-Picayune and the Advocate. I know you mentioned in the past that there was a small but vocal group against the employee vaccine requirement. What has the early response to mandate been like? Do you expect to lose staff, especially because most other hospitals have not required it in Louisiana?
You know, we haven't received a lot of feedback yet, but it's early. I mean, we just put this out this morning. You know, I am hopeful that we won't lose staff. You know, we want to work hard to retain everybody. And certainly it's a very difficult time. I do think you're going to see other health systems and other hospitals around the region also go to mandatory vaccines. I don't think this is going to be something that, you know, just Ochsner or just, you know, FMOL do. So I think you'll see others, you know, follow. But, you know, I'm hopeful that we won't lose people, and we'll certainly do a lot of communication, a lot of education like we've done, and we'll do everything we can to keep folks. But we also have to get folks vaccinated so we can keep them and our patients safe.
Okay. Dr. Hart.
I just want to add to that. Yeah, I think we're like 2,000 hospitals now across the country have recommended or actually have mandated vaccines. And so there is a wave, I think, that's happening across the country, really moving towards expecting and mandating vaccines among healthcare workers for sure. And I think this is going to spawn other businesses to do this. But I think there becomes an imperative. I think we have an obligation. Again, we've talked about this a lot. We have an obligation to our patients to protect them, take good care of them, and not put them and expose them unnecessarily to a disease that can be prevented. So again, I think that's another reason why you're going to see more and more hospitals, health systems require vaccinations for their employees. And then also just a matter of protecting all of our employees. There's no reason not to be doing this at this point.
Okay, I see some more questions coming in about pediatrics. So Rosemary with NPR, can you give data on the children hospitalized in the ICU on ventilators and the same for pregnant women, which I think, Dr. Kimberly, you may have mentioned are pediatric hospitalizations, but do you mind going through that one more time?
Sure. The children currently today are not in the intensive care unit and on ventilators. So we have had children in our ICUs, but today's numbers do not include any of the children in the ICU on ventilators. The pregnant women, we are seeing more and more cases in our hospitals in pregnant women. Some are winding up in the intensive care unit. Some are unfortunately having to be ventilated, intubated and ventilated. And again, we know that pregnancy is a risk for more severe complications of COVID, and there are absolutely no contraindications of pregnancy for vaccination. So all the American College of Obstetrics and Gynecology, the maternal fetal medicine folks, the reproductive endocrinologists have all said pregnant women planning on getting pregnant should all be vaccinated, and that will be helpful.
Okay. Another question from the Louisiana Radio Network. Are you concerned you'll see an uptick in pediatric patients with school back in session? What are your plans, if so, for a possible increase in pediatric patients?
So I would say that I would not be surprised if we see some. I think we need to go back to some of the mitigation measures we've talked about. I think because of the concern about the Delta variant, I think the question is really around what should we do to send kids back to school safely. And the things that we do there are we make efforts at social distancing, and we have them wear a mask. Kids need to be wearing a mask. If they're not wearing a mask at school, there is no doubt we will see increases in the numbers of patients getting sick with COVID, with this Delta variant that we know is more infectious. So again, it's about doing it safely. But we may see an increase. Again, data from last year shows us we can do this safely, but we have to take those mitigation measures.
All right. I do not see any more questions. Here we go. Okay. Emily with the Advocate. The press release mentioned Ochsner affiliated hospitals will decide their own time for a mandate. Does that mean affiliated hospitals do not fall under the mandate? How many of your 40 hospitals are on their own timeline?
I don't know the exact number that are, organizations like St. Tammany Health System, Slidell Memorial Hospital, will make their decisions on their time frame. And they're partners and work with us, all the time. Once again, they govern, those changes, for their own employees, and also being parish-owned hospitals, they have a process they need to go through. So those do not fall under our mandate. It's really the facilities that we own and or that we have management agreements. But I don't have the exact number. We could get that back to you. But our hospital in Shreveport and Monroe, in Lafayette, in Baton Rouge, here in New Orleans, and kind of the New Orleans area, those facilities fall under those mandates, as well as all of our clinics. So.
Okay. Louisiana Radio Network, I have to say this was a new one. This is new for me. We'll see what our team says, that there are reports of parents lying about a child's age so they can get vaccinated. Have any of y'all heard that?
Not aware of that. And certainly with the FDA allowing vaccination under EUA for 12 to 15-year-olds, we are concerned that some people may choose to try to get their younger than 12-year-old child a vaccine that's off-label. And we're cautioning against that because the studies of the proper dosing to be given in these younger age groups are being done now. That data is not available. And so the actual amount of vaccination is clearly not known at the moment. And so we're advising against off-label administration of younger children than 12.
Oh, and thanks, Dr. Kimberly, for that. And I just saw it was Dr. Van Cherry in Shreveport who mentioned it in an interview yesterday about some parents who are lying. So like I said, I don't think we've seen that quite yet.
Yeah, I don't think we can comment on that. I don't think we have knowledge or aware of that. So we'll have to run that down and look at it.
Mm-hmm.
Okay.
Okay. It looks like we've gone through the chat. So I guess at this point, if anyone would like to come off of mute and ask a question, we can allow for that at this time.
This is Destiny Patterson with KSLA. I have two questions. One of them is, can you explain why 12 to 15-year-olds may have been left out of the official FDA approval for Pfizer? And also, is there a deadline for employees to get vaccinated? And will there be termination? What is that going to look like in terms of enforcing this mandate?
So I'll let one of my physician colleagues take the first one on the 12 to 15, and then I'll take the second piece of the question.
Kathy, Dr.
Sure.
Baumgartner?
In terms of the 12 to 15-year-olds, they are continuing to accumulate data after they've undergone the EUA. And so when they have that data and they have to let 6 months elapse is usually kind of the timeline that the FDA uses. And then they will apply if they have the appropriate amount of data and can apply if Pfizer feels like they have that data to apply for the EUA.
And then on the timeline for vaccination, so our employees will have until October 29th to be fully vaccinated. If, for example, and once again, there'll be exceptions for religious and or medical reasons. For example, if someone tested positive for COVID and had the monoclonal antibodies and has to wait 90 days before they get vaccinated, they would get a medical exemption for that. But for folks that are not vaccinated as of October 29th, they will be put on suspension for 30 days. They'll be given 30 days to essentially get vaccinated if they're not vaccinated by terminated from the organization.
Okay, other questions?
Hi there. Oh, go ahead, Emily. Oh, no, go ahead. I've already asked some questions. I just wanted to know what kind of conversations you've been having with vendors and contractors. Those are included in the mandate, as I understood the press release. So is that something, I guess, they were told of in advance and are on board with, or is that sort of something you've just been able to require of them without necessarily sort of an agreement, if you understand?
No, we've been communicating with all of our vendors or any of the medical device companies that have folks that come into our organization. I think that there's a lot of organizations like that if they have people that are kind of out selling or in hospitals, many of them have already mandated that they need to be vaccinated. Many of those organizations have. So we've been, very clear with our vendors about this. And once again, we'll kind of set similar guidelines that they've got to be vaccinated and go through that process. As far as the November date, so they got to be vaccinated by October 29th. If not, they'll be suspended until November 29th, of which time they'll have that month to basically get vaccinated. If they're not vaccinated, they'll be asked to leave the organization, effective November 30th.
Okay, Emily?
Yeah, I was just wondering if you could touch a little bit more on whether there's a plateau on the horizon and any trends happening within the hospital, like if you're seeing admitted patients move to ICU faster. I know there were a record number of deaths reported today, but that also seems to be going along with a smaller number of patients admitted. So I'm just wondering if you feel hopeful and what your outlook is.
I would say that we're concerned because we've seen a decline from the peak, but we haven't seen the continued decline, day after day that we saw really in the first three surges. The first three surges, kind of once we hit the peak, we then saw a pretty precipitous decline after, and we are not seeing that in this fourth surge. We're seeing, our COVID census be, pretty stable now.